Hi, Dr. Butler here. Thank you so much for taking the time to learn more about your health today. Wanted to do an updated video on the heels of the one I just put out, but this topic is, I believe, something that is of interest to my patients with regards to the upcoming COVID-19 vaccination that is going to be starting to become available, I believe, here pretty soon, some different time frames with regards to when that will roll out, and obviously different times of execution for different groups with different risk factors. I believe, first-line workers and people in high-risk categories will receive it first, and then I believe folks with pre-existing conditions, and eventually moving down to the general population. But my purpose of this video is to give some background and education from my experience with regards to thoughts that you should have leading up to getting that vaccine. I have definitely patients in my population who've discussed with me not getting the vaccine. I've had patients in my community discuss with me their concerns about getting the vaccine, and then I have patients who are choosing to get the vaccine. So this information is mostly tied or directed to my patient population that has some concerns and those that are going to get the vaccine, because I think there's some really valuable considerations that you can take into account in order to make that healthcare decision from the best possible place of awareness, and setting yourself up to have the best possible reaction for when that choice is made. And all of this is done in light of the fact that what I'm observing and what I've read about even today, coming out of Britain, there were a few individuals who had anaphylactic response to the vaccination, and their head department of health is recommending that anybody with a history of kind of high inflammatory potential, high allergic reaction potential, avoid this vaccine. So that gets a little skewed as to what demographic of person that includes. And a lot of my patients have high inflammatory potential. That's why I felt the need to bring my thoughts and concerns around that from a place of action that you can take as an individual to improve your inflammation levels prior to making that decision to get that vaccine. And mitigate the side effect potential, mitigate the concerns with kicking in a significant inflammatory response, and possibly putting yourself into a greater health challenge as a result. So going back to Britain for a moment, they're mentioning anybody with a history of high environmental allergens, high food allergens, any other kind of, again, allergenic potential, they're recommending against it. I think the two individuals that had this done were folks that carried around Epipens. So sometimes people do that for bee stings, sometimes people do that for nut allergies, sometimes people do that for asthmatic states. So that's one category. Now, a lot of my patients don't carry around EpiPens. Some felt the need not to as a result of starting to address their inflammatory needs. But I think there's a gray area here of, where is that break point of someone that is deemed to be highly inflammatory, highly allergic, and, just because you're not carrying around an EpiPen, I don't think that is, at least for my patient population, something that I want to just leave as the defining marker of what would indicate you as being, having a non-concern around the possible inflammatory results that can be created per the vaccination. And I think it's good to touch on that for a moment. So what's happening with these vaccinations and the kind of the approach that's being used as opposed to prior approaches from vaccinations is that these are DNA, RNA vaccines. Most of them are RNA vaccines. So what that technology does is, so historically with vaccination, they meaning vaccination developers and researchers would do protein kind of driven vaccinations. What that means is they would take like an egg medium, they'd grow kind of viral particles, so to say, small bits of the virus, they'd grow it out, and they would kind of create almost somewhat of a replication, but a dampened down version of it, of the viral proteins that come in certain viruses, such as smallpox or such as polio or the like. And then, per the injection of that into your body, then your immune system would respond to those viral proteins, and they would bring out a reaction to what's called the antigen. So that antigen, then your immune system reacts to that, and then it creates an antibody, and then that antibody is what is manufactured as a means of memory, so that next time you might become exposed to that virus, then it has some cells to respond to. So that, in my opinion, is a little bit more, we'll say, natural than the genetic vaccines that are being created. Natural in the fact that that's how your body would react to the antigen anyway. Let's say in a natural environment, you get exposed to a virus and it comes in through your nose, eyes, or mouth, and your immune system goes and responds to that protein off of the antigen. So that's, in my kind of line of thinking, that's more in sync with how the immune system would do it, kind of in its own physiology. And as that does that, in my thinking, there's a very kind of reasonable hierarchy of reaction that takes place, kind of checks and balances within the system that will institute an inflammatory reaction. That's what happens when you get sick. Inflammation happens, but it does it in a more sequential fashion. So with the new genetic vaccines, predominantly we're working with an RNA vaccine that's going to be being rolled out. There really is not a presenting antigen. What happens is the RNA gets transcribed into the genetics of the cell, and then the cell kind of creates the antigen, which then allows the immune system to produce the antibody response to that. So it's kind of like coming in the, I think of it coming in the back door and eliciting the reaction from that state, rather than kind of being able to see it coming at you, so to say. So I believe that is likely where this inflammatory process that will become created from these vaccinations is occurring. It's occurring in that kind of back entry genetic response into the cell that elicits this immunological reaction to produce the antigen, rather than having the antigen kind of get introduced into the body. So the consensus is that people should expect per se side effect in the fact that you're gonna feel inflamed, you'll feel sick. Could be a 24-hour, 48-hour process. You at least in the literature and what's being discussed is that then you feel better. You have to get the second dose. Sometimes that second dose, I've read, can be less problematic from the fact of the inflammatory state. Sometimes the second dose can bring a greater inflammatory state. So the inflammation is really the key here, is how much will that vaccination institute an inflammatory response. So my concerns with that with my patients is that if that inflammation is created, how can we put you in the best possible position to try to mitigate that, try to prevent any type of long-term effect. That's my other concern, is just the possible influence of that kicking in autoimmune reactions in the body or exacerbating current autoimmune reactions. So my recommendations start to come around really, first of all, your awareness of where your inflammatory burden currently is. I use my bucket analogy a lot, understanding where that bucket is with regards to its capacity to take some inflammatory burden, and how well is your system working on its eliminatory capacities to get rid of that inflammatory burden so it doesn't build up, it doesn't escalate into greater reactions, in a vision that you can eliminate it and get rid of it in a timely manner, that doesn't, again, perpetuate any problematic concerns. So your evaluation of routine, your evaluation of your self-care, your evaluation, nutritionally, your sleep cycles, your therapeutics that you're using to foster an inflammatory environment are all crucial with regards to when you show up, if you're going to take that vaccination or when that vaccination will occur, that you're in the best possible position, as I mentioned, to be able to receive that and mitigate that inflammatory state. I'm kind of thinking of it of showing up in a high state of vibration. So I think of health as a vibratory mechanism, that when you're vital and when you're in a routine of homeostasis and homeodynamics, that your system is very capable of taking adversity and moving with it, and your high physiologic vibration will not get highly influenced upon the introduction of an inflammatory process. So maintaining that high vibratory state, I believe, is absolutely crucial if you have a history of inflammatory potential. Now, I mean, most of my patients that I see have that because I've seen you when you've had health challenges, and that is absolutely our process of work and care, is to build, reduce the inflammatory process, build your vibratory health, and improve function. So obviously you feel better, do better, and can enjoy quality of life. But for this sake, encouraging you to if you're not already within your routine, to really emphasize that, really show up to the principles of your self-care from an anti-inflammatory standpoint, so that you can, like as I mentioned, approach this in the best possible position to reduce the potential side effect profile, and have it be a successful health intervention for you. The other principle that I love to talk about a lot is not just the physical body. So remember, the physical body is crucial as much, though, as is the mental emotional body. So a lot of people are in positions right now of higher stress, feelings of anxiety and depression and cyclical natures of that, which is all fairly understandable based upon our environment that we are in. But please remember that your mental emotional health, your level of thinking, is just as important as how you're taking care of your physical body from an inflammatory standpoint. So remember, when you're in a state of fight or flight, your thinking's in a state of fight or flight, which leads with more fear and concerns, and then you're going to be at a higher inflammatory potential because of the thinking kind of alludes to some problematic environment that might show up. So working on your level of thinking is very important as well, to be kind of in a present state, be very thoughtful of just taking what's in front of you, understanding what you can control, what you cannot control, are big crucial parts, again, of the process of maintaining this physiologic vibration. So I just wanted to reach out, go over this topic with you, encourage you to be in your place of self-care routine, and be thoughtful being preventative by nature to put yourself in a good position to respond to the healthcare choices that you will make. And I hope this helps, and I hope you have a wonderful holiday season, and I would look forward to seeing you soon. Thanks.